My name is Andrew Bivard and I'm an Associate Professor at the University of Melbourne. So I want to talk about the Melbourne Mobile Stroke Unit Tenecteplase versus Versusalteplase for stroke trial that we've recently finished up. So in this trial, what we were looking to do is combine two very exciting elements that are coming together in stroke at the moment. So that is, first off, the use of mobile stroke units, which have been recently validated to show that they improve patient outcomes through earlier delivery of treatment, as well as the use of Tenecteplase as a frontline thrombolytic agent. There's a number of ongoing and finishing clinical trials at the moment, 3 additional of which are being presented at this very conference this year. Tenecteplase has a lot of advantages and they're particularly suited to the mobile stroke unit setting because they're a bit more practical. It's easier to administer, and that's certainly a lot of feedback that other studies are presenting with. So what we sought to do with today's study is combine those two advances, and what we undertook was a randomized open label superiority trial of Tenecteplase versus Versusalteplase in acute stroke treatment delivered on the Melbourne Mobile Stroke Unit, which is a single site that delivered patients to 5 hospitals in the same region. Patients were seen on this mobile stroke unit by a neurologist and an acute stroke nurse, as well as a paramedic and radiographer. Patients underwent standard of care brain CT imaging on the mobile stroke unit with angiography if the clinical team thought it was necessary, and then randomized into the trial. The primary outcome was the volume of the perfusion lesion in patients randomized into the trial at the receiving hospital after treatment. Secondary outcomes were a reduction in NIH scores between MSU assessment and the ED assessment and at 24 hours, as well as changes in the modified Rankin scale depending on treatment allocation. Secondary safety outcomes were proportions of severe clinical deficit at 90 days, as well as death due to any cause at 90 days, or the onset of brain hemorrhage. Over the course of the trial, from the 20th of the 6th, 2019 to the 16th of the 11th, 2021, so fairly recently, 104 patients were randomized into the trial. This is out of 530 patients who were screened for the trial at that point in time, and of 162 who went on to have brain imaging on that Melbourne Mobile Stroke Unit, which gives us a 64% study enrollment rate, which is pretty fantastic from a clinical service. And you see that baseline, the patient's characteristics were well matched between the two study groups, with a median NIH of 8 in both patient groups, and quite an early time from onset to randomization and therefore treatment in the patients. So on the primary outcome of the trial, patients treated with Tenecteplase did have a significantly smaller perfusion lesion than patients treated with Versusalteplase. We also saw a greater reduction in the NIH from MSU to ED in patients treated with Tenecteplase compared to Versusalteplase, with a median difference of 1 NIH point, which is pretty impressive considering the time from treatment to hospital was 47 minutes. Patients were also treated earlier with Tenecteplase compared to Versusalteplase on the mobile stroke unit, or treated from time of CT to initiation of treatment by about 7 minutes compared to standard of care Versusalteplase. There were no differences at 90 days between the two treatment groups, but that's because a number of patients went on to have thrombectomy after patient enrollment and ED CTP as well. So there was a bit of an imbalance there. Also, it's important to note that of the study, about 40% of patients were presented to the MSU with a large vessel occlusion. So you're looking at a good stroke cohort over there. So overall, what we present today are the trial results for the TASTE in the Ambulance clinical trial. Showed that the ultra early administration of Tenecteplase on the Melbourne Mobile Stroke Unit led to a greater reduction in the perfusion lesion volume compared to patients treated with Versusalteplase. They were also treated faster and had a greater clinical improvement from time of treatment to hospital arrival. Just want to thank our trial funders, which is the Australian Medical Researchers Futures Fund, and all the trial team who were involved in enrolling patients in the trial. Thank you very much.